Hello and welcome. I'm Maria Williams with the Collaborative on Health and the Environment. CHE enjoys bringing you the latest environmental health science through our partnership calls and webinars, science serves, publications, and social media. I would like to welcome everyone to today's CHE partnership webinar, which is titled Intervention Studies, Lifestyle Changes that Limit Toxic Exposures and Implications for Policy Change. Our moderator today is Karen Wang, Director of CHE. We will leave time following the presentations for a brief Q&A session. You may type in questions through the Q&A feature available on the menu bar at the top of your window at any point during the presentations. After the presentations, our moderator will read out questions for our panelists to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 45 minutes and is being recorded for our call and webinar archive. With that, I'll turn things over to you, Karen.
Great, thank you so much, Maria. We're very excited today to hear about two recent intervention studies that investigate day-to-day exposures to toxic chemicals and to learn about whether individual changes matter, but also about implications for policy changes. Our first speaker is Dr. Julie Herbstman. She is an associate professor in the Department of Environmental Health Sciences and the incoming director of the Columbia Center for Children's Environmental Health. Dr. Herbstman's research focuses on the impact of prenatal and early life exposures to endocrine disrupting environmental pollutants. Our second speaker is Dr. Kendra Klein, who is a senior staff scientist at Friends of the Earth, where she leads work on food and farming solutions. She holds a BA in Interdisciplinary Studies and a PhD in Environmental Science, Policy and Management from UC Berkeley. Just a reminder, you can at any point type questions into the Q&A area, but we will be holding questions until the Q&A period at the end. So thank you so much for joining us, and Julie, over to you.
Great, thank you so much. Thanks Maria and Karen for organizing this webinar today. I'm happy to be able to present some of our work that we've been doing, looking at flame retardant exposure and whether an intervention study can reduce exposure. So just a bit of background. Flame retardants are found basically all over the indoor environment. They're found in building materials, electronics, furniture, vehicles, plastics, polyurethane foams, textiles. And you can see here from this graphic how we think they get into our indoor environment. And so this is an example from a couch, but the flame retardants, which are applied to the foam inside the couch, end up off-gassing from the foam, settling into dust, and then we get dust on our hands. Cats get dust on their fur. And then when we put our hands in our mouths inadvertently, either by eating or if you're talking about a toddler, sort of through everything, dust that contains flame retardants are inadvertently ingested. So exposure in children, as I alluded to, is a major concern. Again, this is partially because kids put their hands in their mouths all the time. So this is actually a picture of my, my daughter when she was about 4 months old, and constantly something was in her mouth, right? And there was I felt like nothing I could do about it. What worries us about the fact that kids have more exposure isn't just that they're more exposed, it's also that they're likely to be more sensitive to the effects of exposure. And so the constellation of flame retardants has changed over time, which is seen in this graphic. PBDEs, polybrominated diphenyl ethers, were a compound that were used for quite a long time. And that's what was sort of prominent in terms of the flame retardant story. Starting in the beginning of the early 2000s, that constellation shifted because of a phase out of these compounds, only to be replaced by other compounds. PBDEs have been shown to be developmental neurotoxins, and the other replacement compounds, including chlorinated tris and some fire master compounds, are less well studied in terms of their toxicity, but there's some evidence that there's probably some neurotoxicity. So EPA recognizes that exposure is potentially of concern, and so they issued some advice in 2016 trying to advise people about how they could reduce their children's exposure to flame retardant chemicals. And this was the advice that they gave. Wash your hands, wash your children's hands more often, particularly before you eat. Dust frequently with a moist cloth. Use a wet mop or vacuum with a HEPA filter. Prevent small children from chewing on products that may contain chemicals, which is aspirational, I think. Repair tears in upholstered furniture, and clean the interior of your car and dashboard. So this was the advice. But to our knowledge, there was no evidence that indicated whether or not this actually worked at reducing flame retardant exposure. And so we set out to test this. So our study design involved a population of children, mothers, and newborns that we had been following from birth. This was the Sibling Hermanos study, which is based in northern Manhattan and the South Bronx. From this larger cohort, we selected 32 mothers and their children who were between the ages of 3 and 6 years old. Again, focusing on this sort of toddler age where they're on the ground, hands and mouth, to see what we could understand. Our cohort is comprised primarily of African American and Dominican families, and so we took half and half. And we followed them for 2 weeks between December 2015 and May 2016. Here's what we asked people to do. We sort of based our advice on the EPA guidelines, where we said, okay, we're going to create 2 intervention groups. One is a hand washing group and one is a house cleaning group. And for the hand washing group, we said, okay, try to wash your hands more often, particularly before you eat. Encourage your child to wash his or her hands. In the house cleaning group, we advise them to try to remove dust from around your house. Use a vacuum as much as you'd like. And in general, we suggest you open your windows to reduce exposure from recirculating dust. We supplied them with reminders, magnets, things to put on their mirrors, soaps. We gave them mops, we gave them a vacuum, we gave them some house soap, again, trying to be sure that this was non-toxic in the sense that it also didn't contain phthalates and other chemicals, triclosans, that we were also concerned about, but not with respect to this study. So our design was a crossover design where we had we did a baseline where we went into the home, took a urine sample and a hand wipe sample from all the moms and the kids, and then randomized them to either the hand washing group or the housekeeping group. Then we waited a week and let them go at it. Came back after that week and took another urine sample and another hand wipe sample, and then we gave them the other intervention. So if they started it with hand washing, we then gave them the vacuum. If they started with house cleaning, we then showed up with the hand soap. So in the second week, everyone was doing everything. And then we came back after the second week and took another urine sample and another hand wipe sample. This is what we measured. So in hand wipes, we were able to measure the parent compound of a whole bunch of different flame retardants, some of the PBDEs and then some of the PBDE replacements. In urine, we were able to measure the urinary metabolites of these parent compounds in most cases. And here's what we found. So generally speaking, let me orient you a little bit to the graph. We have on the y-axis, you have percent change after 1 week of hand washing. The hand washing group, you see that exposure to these flame retardant compounds generally went down in urine for the most part, some of them significantly so. For the house cleaning group, they also went down for the most part. And then when on the second week, when everybody was doing everything, this is what happened combined. So for the most part, in urine, the exposure levels did go down, with the exception of DPHP. Why it went up, I'm really, to be honest, not sure. So I should say that we measured the urinary metabolites only in the moms, and the same for the hand wipes for this intervention study. And that was mainly for funding reasons, because you can imagine if we have 32 moms times 3 samples per mom, it starts to become actually quite a lot of samples that we're looking at. The other thing is that we had a complete case set for the moms, for the mothers. For kids, it was harder to get a urine sample, particularly in a younger kid, so we had more missing data. So we decided to focus just on the women in this study. The hand wipes were a little more variable in the sense that when we looked overall at everybody, we didn't see a whole lot of anything. And then what we did was we stratified on those with higher exposure at baseline. So among people who had higher exposure at baseline, so higher meaning above the median, we generally saw a reduction in exposure through all of these parent compounds that we could measure on hand wipes. What you see in blue, on all of these slides, I should have pointed out that you see a point estimate, so that's the little dot, and the line going through, the vertical line going through that is the confidence interval. And so where it crosses 0, that would mean it's not statistically significant. Where that whisker does not cross 0, that's where you see significant findings. I'm sort of giving you a 10,000 foot view where I'm just showing you the overall trend, and you can see that for the most part, exposure did go down, right? So there's a % change in the negative direction. The blue dots tell you, we did a sensitivity analysis because one of the things we were worried about was that if we just looked at people with high exposure, maybe there's regression to the mean, so that maybe just naturally due to normal variation, your exposure is likely to go down if you start high. But when we did a simulation study to try to understand this, we were able to see significant results in these blue compounds as well. So just to conclude, we detected PBDEs, alt BFRs, and organophosphate flame retardants in 100% of the participants that we studied. It seems that both house cleaning and hand washing was able to reduce exposure up to 50%, but this was most evident among individuals who started out high. So if you had high flame retardants to begin with, the interventions were able to reduce them. If you sort of had low or lower flame retardant concentrations at the beginning, you didn't have there was less space for you to reduce. But it's notable that none of the interventions that we studied were able to reduce exposure below the limit of detection. So even after hand washing and after housekeeping, they were able to reduce exposure, but they weren't able to eliminate it. So we concluded from this that behavioral change can reduce but not eliminate flame retardant exposure. And just to think this through a little bit and talk about some of the limitations, clearly this is a small study. But we did have repeated measures within the same person, but we only looked in moms. And so I think it's still an open question about whether hand washing and housekeeping actually reduces exposure to children. We weren't able to test that with our study. We also only evaluated our intervention over a 2-week period. So it's not clear that these behaviors are sustainable, right? So if we went back to these families now, would their exposures be the same, or was it just because we were there with the reminders, giving them soap, giving them, sort of incentivizing them to follow, our guidance? And so it's not clear that you can sustain this sort of thing. One of the other things that we grappled with was the fact that hand washing you can do anywhere, but housekeeping is only effective for exposure that's occurring from your home. And so while we know that people spend a lot of time in their home, exposure is happening in lots of other places. So in public transportation, movie theaters, and offices. And so house cleaning is only going to be effective at reducing exposure that's occurring in your home in an environment that you can control. So in terms of reducing the totality of exposure, it has sort of a limited space where it can work. And then the last point that I always keep in mind is that it's great that this intervention appeared to work with all the caveats I presented, but it didn't eliminate exposure. And so that to me indicates that while an intervention is good, it's really not a substitute for policy. And so that's where we can have sort of a sustained change over the long term. So this work was published and is accessible in full text open access at the link below. Additionally, we did a report comparing exposure between mothers and children, and this is also available. The sample size is a little smaller, and I didn't talk about that here. I also want to acknowledge Lizzie Gibson, who is a doctoral candidate in my department. She's the one who ran all the analyses for the study that I just described. You see here all the folks at the Columbia Center for Children's Environmental Health, where the work is based out of. Dr. Kim Anderson did some of the analyses as well. She's at Oregon State, and Dr. Heather Stapleton at Duke also did some. And the work was funded by the John Merck Fund, and Lizzie was funded by some T32 fellowships. My contact information is at the bottom, and I'm looking forward to hearing your questions.
Great, thank you so much. Kendra, over to you.
So thanks so much to Che for this opportunity. I'm going to tell you all about organic diet intervention study that we ran, as well as how we're using that study at Friends of the Earth for public education and policy goals. So this was published in February, and I just want to thank the team that made this possible. Carly, Asa, and Robert from UC Berkeley, Roy and Igor from UC San Francisco, and Cheryl Patton from the Commonwealth Biomonitoring Resources Center. And this study was funded largely by Friends of the Earth members and major donors. We also had some foundation support from California Consumer Protection Foundation and the Turner Foundation. So to frame the issue here, we use over 1 billion pounds of pesticides in agriculture in the US every year. And for the general population, diet is a primary route of exposure. The USDA annually tests food samples for pesticide residues. They largely test produce. In the 2016 data, they found that 77% of samples had a detectable pesticide residue. 99% of those were under the EPA tolerances or legal limits for residues. Here's a snapshot of what's found on apples, and this is from Pesticide Action Network. It's a really great website, What's on My Food. You can search by food item or by pesticide. And as you can see, and apples are one of the more highly contaminated foods, but a range of pesticides, many of which are associated with health concerns. And so we were interested in both understanding exposure and how to reduce exposure to these pesticides. And organic is an obvious way to reduce exposure, and that is because by law, organic farmers are not allowed to use the vast majority of the pesticides that are allowed in conventional agriculture. So this is a graphic from Organic Trade Association. You can see conventional farmers are allowed to use 900 some synthetic active pesticide ingredients, and those are formulated into an estimated 17,000 different pesticide products that are on the market. And in comparison, organic farmers are allowed to use naturally derived substances as well as 25 synthetic pesticide ingredients. And they are only allowed to do so after they've attempted other means to control pests or weeds. And those are ecological farming methods like rotating crops or introducing natural predators. And also, just to give you a sense of what's on that list, these are just a few that I pulled. So we looked for some of the most commonly used pesticides in U.S. agriculture, and those that are found, not just U.S., but I guess global agriculture, and also those that are found frequently as food residues. We also tested for, so these are, you're seeing the 14 analytes that we found in all of our study participants, representing organophosphate exposure, pyrethroids, the neonicotinoid clothianidin, and the herbicide 2,4-D. We also tested for another neonicotinoid and imidacloprid, and for 3 fungicides, thiabendazole, iprodione, and boscalid. And we didn't find those. It might be a limit of our testing method. In the case of imidacloprid, we think it might be because of the metabolite that we chose, because all 4 of those and other biomonitoring studies have been found in people. We recruited 4 families from across the country. I will tell you a bit more about these families. Obviously, we were looking for families that were willing to share their stories publicly as part of our public education goals around this work. And we looked for racially diverse families, 2 Caucasian families, African-American family, and a Latino family, and in locations where we have partnerships on the ground with other organizations that are working on policy related to pesticides or organic. And we did a 6-day intervention. So the families were on a conventional diet for 6 days, on an organic diet for 6 days. To ensure compliance, we had families write out a grocery list, and research assistants went out and did their grocery shopping during the organic intervention. We substituted everything down to oils and spices. And also, because these are families with kids and very busy, we had licensed chefs who made their dinners, and those were dropped off to them just so they didn't get very busy one night and end up ordering a pizza. So we had very high compliance. They kept food diaries, and very, very few moments of maybe a couple pretzels before they realized they were up during the organic diet phase. We considered both of the first days of those phases to be washouts. So we analyzed 10 samples for each participant. They gave us a first morning void urine sample, and those were sent to UCSF and to the Quebec National Institute of Public Health for analysis. So we ended up in total with 158 samples. And of those 14 analytes that we found, everything dropped within 6 days on an organic diet. So our most dramatic drops you can see were in the organophosphates. MDA is the metabolite for malathion, that dropped 95%. TCPY is the metabolite for chlorpyrifos, and then DAPs represent a much larger set of organophosphate exposure. Pyrethroids were generally halved. Clothianidin down 83%, and then 2,4-D 37%. We were obviously interested in dietary exposure, but we know that people are exposed through other routes, primarily through use of pesticides for pest control, insecticides for pest control, or herbicides for lawn and garden care. Of those uses, the pyrethroids and 2,4-D are likely what people are most exposed to for this set of pesticides that we were looking at. This work builds on a growing body of research that shows that switching to an organic diet does reduce exposure to pesticides rapidly and dramatically. So the top are diet intervention studies that, like ours, took a set of people and switched their diets for a given amount of time. In a couple of these studies, they actually switched back to the conventional diet and tested them again. The bottom 2 studies are comparisons of self-reporting, so asking people about how much organic food they do or don't consume. And all of these studies show a decrease in exposure on an organic diet. But despite this growing evidence and other evidence of the health benefits of organic diets, there's a lot of misinformation in the media. These are some few choice headlines that I pulled. And some of this is lack of understanding of the science. We also know that some of this is disinformation efforts on the part of the pesticide industry. So Friends of the Earth, along with some of our colleagues, have documented that the pesticide industry really has taken a page out of the playbook from the tobacco industry in terms of manufacturing doubt around the benefits of organic and also the health harms of pesticides. And so the stakes here are quite high for both public understanding as well as policymaker understanding, really, of why we should be concerned about exposure and interested in reducing exposure. And this is something I don't need to convince this audience of. We know that the latest science increasingly shows us that small exposures matter, and that the most vulnerable among us are children and infants and infants in utero. This is a great article in Environmental Health News by Carrie Gillam that really translates that for a lay audience. Why our regulations have not kept pace with the latest science. And we also know that cumulative exposures add up. And so if each of those residues is below legal limits, that doesn't necessarily mean that the exposure is safe, because we're exposed to a cocktail of different pesticides with each meal that we eat. So this is an analysis that showed that approximately 40% of US children may be exposed to organophosphates at levels that are greater than benchmarks for neurological harm. So we were interested in really getting the findings of this research out to the public, both getting them the facts, but also knowing that people respond to personal stories. And so we created a website, organicforall.org, where we've got all of the results of the study along with additional information. And we're also doing a bit of narrative judo here, because organic is tarnished with the image of being elitist. And while there is a very real access issue that we need to address in terms of organic being affordable for all people, if we just shift the lens a bit and think about the general public's daily exposure to pesticides, and how that really is a form of toxic trespass, organic becomes a human rights issue that we should not have to all go into the store and shop our way out of those exposures. And one of the moms in the study expressed this really beautifully. She said, everyone has the right to clean organic food. That is a human right. And we're also expanding people's circle of concern beyond themselves to understand the impact of pesticides throughout the food system. So the latest science also shows that neonicotinoids, increasing use of neonicotinoids are driving massive declines in pollinators and in other insects. You've seen headlines recently of insect apocalypse and second silent spring. So Friends of the Earth is also will be coming out in coming months with a study in relation to that. And farmers, farm workers in rural communities are on the front lines of exposure and suffer the greatest health harms due to the pesticide use in our food system. We've been working with organizations on the ground, a whole set of organizations from beekeeper organizations to farmer and farm worker organizations. This reflects some of that work. Rudy Arredondo from National Latino Farmers and Ranchers Association, who is making this connection between benefits of organic, not just for consumers, but for farmers and farm workers. And we created a social media video to get this message out far and wide. So far, we've got about 330,000 views. You can find this video if you go to YouTube and you search for Organic for All. And then you can use this link. There's also a version that doesn't have captions if you want to use it for educational purposes. And there's also a 6-minute version of the video that gives a little bit more context that is on our website. And finally, there's a whole range of policy work that we're doing that this research supports. In Maryland, we've been working closely with Maryland Pesticide Education Network on a bill that was just introduced to ban chlorpyrifos. Many of you likely know the EPA was set to ban it in 2017, but the Trump administration reversed course on that ban. So the lack of administrative action, a number of states have been working on bans. Hawaii was the first to ban it. And we're also supporting the Ban Toxic Pesticides Act, which is a federal bill to ban chlorpyrifos. And, you know, this is the challenge we have, is this sort of one by one banning the worst actors. But of course, we also need a wholesale shift, wholesale decrease. And the real benefit of organic farming is that it's the solution. It's here. We've got decades of data that show that we can, in fact, grow abundant food with organic and ecological farming. And so we're also working on shifting policy supports and incentives, which right now really prop up a pesticide-intensive food system, towards supporting farmers to transition to organic. So I also look forward to any questions, and thanks so much.
Great, thank you so much. So everyone can type their questions in. We're going to start off with some questions for you, Julie. There were quite a couple of questions about methods, so I thought we would just kind of get some of those out of the way. Someone asked about a control group, and there was another question about, did you, along with the measurements, did you accompany with a survey to find out whether or not the behaviors were actually followed, and how frequently during that time period? And someone asked actually about occupational exposures. Was that something that you also asked participants about?
Right. Those are great. They're great questions. So first, let me start out by talking about the control group. And no, there was no control group. In retrospect, I would have done that. I think that would have made sense to see how over a 2-week period of time, what sort of natural variation there is in exposure. So we didn't do that, and I sort of wish we would have, because that would have helped us understand, sort of the natural variation. And I think that's where we went to the simulation studies to try to understand, given what we see, how likely is it that we would have seen a reduction to the extent that we did, taking into consideration chance. The other questions, in terms of a survey, yes, we did give them a survey each time we saw them, asking them, like, did you actually do what you said you were going to do? And we found that for the most part, people said they did, to varying degrees. So one of the challenges in designing this intervention was to try to figure out how prescriptive we should be about, if I say wash your hands more, if you're already, somebody who washes their hands all the time, is washing your hands more going to make any difference? So we tried to account for that sort of thing to the extent that we could, and found that this is all described in the paper, but we found that the only thing that made a difference really was the amount of time someone spent in their home before we got to them. So we tried to control for that in our statistical analyses, but again, it's a relatively small sample size, so we didn't have that much capacity to look at additional sources of variation, although we did try. And sorry, the last one was asking about occupational exposure. Yeah, so we got information about this, but for the most part, that, other than we again, it's a small sample size, so we didn't have a ton of variation, and these are typically not folks who have high occupational exposures beyond what would be in a normal sort of office, retail space setting. So none of them were factory workers or something like this, where they would occupationally come in contact with high levels of flame retardants, more so than the average person.
Great, thank you. Let's see, there was a question also for you, Julie. Were there any trends of effectiveness of intervention with the physical chemical properties of the flame retardants? For example, easier to limit organophosphate flame retardants or halogenated flame retardants? And that another person also asked about what is the half-life of these chemicals in the bodies? Would a longer study period show more effect?
Also really good questions. And so one of the issues is that we're looking at really a number of different classes of flame retardants, and the reality is that we're exposed to all of them. So we could have done this one by one, but we opted to look for sort of this constellation. The PBDEs have a very long half-life, on the order of years. So, and they're typically not measured in urine, they're typically measured in blood. But over a course of a 2-week period, no matter what we would do, we're unlikely to see a change over that period of time. And so we didn't measure a PBDE biomarker in a before and after setting, because it really just doesn't make scientific sense. The other compounds are more quickly metabolized, so we did think that over a 2-week period, it would be reasonable to see a reduction. And so they're metabolized in the course of hours. So again, we tried to control for variation in how long have you been at home before giving us a urine sample, how long, when was the last, how hydrated are you, so how diluted is the urine sample. So we tried to control for these things analytically. I think one of the strengths of the study is that we were able to use hand wipes and urine samples, so we were able to look at both parent compounds. So for the PBDEs, measuring parent compounds on hand wipes would make it, we would expect to be able to see a reduction on hand wipes, because that's not being dictated by a half-life. So we have a, sort of a mix of what we were able to do and what our limitations are.
Great. Kendra, maybe I'll ask you a similar question. In terms of the different pesticides, do the half-lives of the different types of pesticides, would that affect your study period? And, how do you think a longer study period would affect the results?
It's a great question, and I don't know the answer off the top of my head. Of those other intervention studies, I think that the longest organic intervention was 14 days. And this is inspiring me to go back and look at their results in comparison to ours. It would be fantastic if somebody was able to do a longer intervention. Obviously, there's limitations in terms of cost and participants' ability to maintain that diet for a long amount of time, but that would be really important work to do.
Yeah, great. Julie, another question for you. Someone asked, why did you choose these specific demographics? And just as a follow-up question, do you think there would be differences if you chose different demographics? Do you think that flame retardant exposure in the homes differ by different demographics?
So I think it's also an interesting thought. We studied these populations, so African American and Dominican women, because we have at the Columbia Center for Children's Environmental Health, we have longitudinal birth cohorts that recruit out of the local area. So I'm located in northern Manhattan and South Bronx, and the local area is basically, the population here is predominantly Dominican and African American. So we studied people who are local. I think that everyone is exposed, so I don't think exposure is unique or distinct to them. I will say, though, that especially with respect to some of the older flame retardants, like the PBDEs that have been phased out, there is an economic issue where if you have the means to replace your household products with, a new couch that now meets the new California state bulletin that doesn't require chemicals, you can do that. And so that does require means. These women are typically lower income, and so there's some thought that maybe their exposure would be higher, particularly to the older compounds, because they're not maybe as quick to replace their older couches and upholstered furniture. The other thing is it's possible that they're more likely to have secondhand furniture. And again, as the polyurethane foam ages, that's when it's going to sort of break apart and sort of off gas in a way that is detrimental. So I think there's a good possibility that exposure might be higher, particularly to the older compounds in this population, but I don't think that the results are, I think they're sort of broadly generalizable. to a larger population.
Okay, great. Someone asked about, and I guess I'll ask for both speakers. Did you guys have social economic status information on participants, and was there a difference based on social economic status versus race? Kendra, did you guys look at that?
We did. We recruited quote unquote middle class families. So we have that data. We didn't report it in the study, and it wasn't a factor of our analysis, either race or socioeconomic status.
Julie?
We also have that information. It was reported in the paper. There is, while there's variation in socioeconomic status, it's not a wide variation, and it's not that easy to disentangle that from race. I think the biggest thing that differed in these two populations is sort of house cleaning. I don't know exactly how to say it, but sort of the cultural way that people clean their homes varies. And so again, the recommendations were pretty broad. We were trying to follow sort of what the EPA says, which is also pretty broad. But it's tricky to tell somebody to clean their house more and to try to be culturally sensitive to the way that they've always cleaned their house, that we're not implying that you don't clean your house well or you should do it better or anything like this. So it didn't seem to us that SES was a big factor. Again, the racial issue is, if it played into the story, I think it plays into the story in the cultural practices that impact cleaning patterns and cleaning styles.
Great. Just one last follow-up question, since you mentioned the EPA recommendations. Did you share your findings with people there, and what were their reactions to and responses to the advice that they're giving in reference to flame retardants?
I don't know. I'm sure that we've done a number of, this project's been reported in the media a fair bit. I haven't heard anything from EPA. I think largely it's, what we're saying actually supports their recommendations. So I think my guess is that they would be happy with what we found. That said, we tried to reiterate in the paper as well as in any media reporting that we've done, is that this is a nice this can work, but there are caveats, and it's not a wholesale solution. So it's nice to be able to tell someone something, like what can you do right now, because we know that shifting policies, it's a long road. So we feel good that we can say something in the short term, but it's not clear that that's going to really solve the problem. So we tried to emphasize that in our reporting.
Great. Kendra, I have one last question for you. Have you followed up with the families since the study, and what have been their reactions to what you found, and whether or not they're going to try to make changes, even without of course not as perfect as having a delivered chef dinner?
Right.
But yeah, what have been their reactions to the studies?
It's a great question. I saw each family for an individualized report back, and I haven't given them a call to ask, once they've got those results in hand, has that shifted how they're eating? I do know that Lana family in particular, I think, has been inspired, but that'd be great to just follow up with them individually and see. And the challenge is, of course, it's easy to do when you've got chefs delivering your meals, and it really, again, begs that question of how do we create a system where there's more organic food available to more people in an affordable way, in an accessible way, so that it's easy and it's not a challenge for people to shift their diets.
Okay, great. So I think we're at the end of our time. So Maria, we'll turn it back over to you.
Great, thank you, Karen. We are approaching the end of today's webinar. A video recording will be available on the CHE website soon, and tomorrow you will receive an email containing a link to the video. CHE's next webinar from the CHE EDC Strategies Partnership will take place next Wednesday, March 20, and is titled Exposure to DES During Pregnancy and Multi-Generational Neurodevelopmental Deficits. To learn more and to RSVP, please visit our website at healthandenvironment.org. If you are new to CHE and would like to stay updated about upcoming events and more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website. Additionally, if you appreciate these CHE partnership webinars, which bring you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers for taking the time to present today and Karen for her excellent moderation. Thank you so much for joining us and have a great day.